So, what's going on today?
One of our patients is having trouble breathing and has a low oxygen saturation.
Okay, not a problem. What was the last O2 sat for the patient?
I don't know. I haven't taken an O2 sat reading.
You haven't taken an O2 sat at all? Then why did you call us for a patient with a low O2 sat and also tell me the patient currently has a low O2 sat?
Well, the patient seems to have trouble breathing, so I would think their oxygen content was low.
And what about this patient seems to show that he's having trouble breathing? His breathing is normal and unlabored, and his lung sounds are normal. I see no difficulty.
Well, he was coughing.
Coughing? How long was he coughing and what kind of cough did he have?
He only coughed twice, and it was a normal cough.
Are you serious? So you called me for a patient with a low oxygen saturation that you didn't even check, and apparently is having difficulty breathing after coughing normally. Twice?
Yes.
This has got to be some kind of joke. Well, what history does this patient have?
No major history other than dementia, and he is also paralyzed from the neck down.
Well, since you obviously don't know how to do your job, let me check the patient's O2. 98% room air. So it's quite obvious that the patient is having no difficulty breathing and has a perfectly fine O2 sat. Why the hell are you wasting our time when there are real emergencies to go to?
Well, he also fell out of bed last night. I believe he had a head injury due to the fall.
You're fucking kidding me. Please explain to me exactly how a quadriplegic patient falls out of the bed with rails? Or even manages to move, for that matter?
I don't know. I just know I found him on the floor last night.
So you found him on the floor last night, and decide to tell someone about it at 3 a.m. the next night?
I didn't think he was hurt.
Yet you just told me you believed he had a head injury due to the fall? As I can clearly see and feel, there are no injuries to the patient's head. Did they magically heal in 24 hours?
I'm not sure. I didn't look at his head. I just got a nurse to help put him back in bed. But I figured since you were going to take him to the ER that you could have them do a head scan to check.
You're an idiot. I hope you know that. What hospital are we taking him to?
The Lower Right Southern Wall Center.
Great. Well, go look pretty behind your desk while we get him out of here.
I'm sorry for the inconvenience.
No, you're not. If you were sorry, you would learn how to take care of your patients instead of calling us to do your job for you.